Morning, everyone, and today our topic of discussion is wound healing and why wound healing is important because all the surgeries which are done, of course, um, as a result of surgery, we create a wound, and the repair of that wound is very important. And it's like one of the things which can happen after surgeries is a delayed wound healing or a wound which is not healing. So not just in surgeries, like whenever there is any wound in the body, of course it should heal properly without any complications. So that's make this topic a very important one. Um, now, what is wound repair or wound healing? Of course, whenever there is any injury in any tissue, the tissue basically restore its normal functionality and structural integrity. So, uh, if you can see over here, um, the wound healing, by which the tissues or the body they attempt to restore the structural and functional integrity after injury. There could be you can see like the wound healing is the normal response to injury, and there could be acute wound healing and chronic wound healing. So, what is acute wound healing? When all the things are normally going and it happens mostly after uncomplicated injury and require very less intervention by the doctor, by the medical health provider. And then there is chronic wound healing, like when the things does not follow an orderly progression of healing and often necessitates a variety of interventions to facilitate closure. So now, uh, remember this thing that wound healing is a complex process. There are many chemical or biochemical and cellular cascades which are initiated and uh, that are those like which basically uh, bring back the normal integrity and the functionality. So all the tissues they have almost a similar mechanism of wound healing, and the process is basically uh, the same. Like there is the phases of hemostasis, then there is the phases of inflammation, and then there is a phase of uh, what you can say. Uh, sorry. Then there is a phase of like hemostasis. There is a phase of inflammation, and then there is what you can say cellular tissue regeneration, in which like there are many. There is epithelialization, there is proliferation, there is maturation, and then there is a contracture. We call it as remodeling of the tissue. Okay. Now, in this lecture, what we are going to discuss is the factors which basically hamper or impede the normal healing. For example, there are many local factors, many systemic factors, and many technical conditions which are involved for normal wound healing. So now, um, as you can see over here, whenever there is any injury, okay, whenever there is any injury uh, to the to any tissue, any part of the body, you can say, which could be surgical or which could be traumatic. So any surgical or traumatic wound, of course, like it starts the cascade or different events like to bring back the normal state, and The factors which can hamper or which can block this process or which can delay this process, we are going to discuss later. So, generally speaking, wound healing can be classified or can be staged in three different stages: inflammatory stage, proliferative stage, and maturation. And then we are going to discuss some special wounds as well. For example, decubitus ulcers, or what we can say bed sores, or pressure sores, and as a result of burns, there are sometimes eschar formation and things like this, right? So, uh, of course, like hemostasis, we all know what is hemostasis. Whenever anyone get any injury, the first thing which happens is that the platelets, they make a plug over that region, and all those processes which are involved now, really, it's a complete different lecture, different topic, that from the injury side, when the epithelial cells are damaged, they release many factors. One of them is von Willebrand factor and factor 8, they are also there, and they result into the clump formation of the platelets, as well as what you can say, the platelets are attached to the epithelial lining, which is called as what you can say, adhesions, for like adhesion of the platelets. And there are many uh, what you can say, receptors like glycoprotein 2b3a and things like this. So simply, that is simply all the processes, or you can go and study back hemostasis, what is that. uh, like, if you want to know how you can search that, of course, go and study the coagulation cascade. Okay, what is the first stage of coagulation, what is the second stage of the coagulation? Okay, what are the role of clotting factors, what are the role of different enzymes, and what are the role of different drugs which we give, like aspirin and drugs like this clopidogrel, what they do. So anyhow, whenever there is any injury, the first stage is to stop bleeding. And after bleeding is stopped, of course, like, there is some exudate is formed. Exudate is formed as a result of migration of different cells to that site. So that marks the inflammatory phase. And after that, after some days, what we can see in that site where there is injury is the formation of granulation tissue. So when we see granulation tissue, by the way, that marks what we call it as proliferative phase. Okay, and then there is a stage when, of course, like, the wound gets started contracting, there is scar formation. So what that stage is like, that is like the maturational phase. Okay, discussing again, like, this is basic things, and I'm going to talk a little about them, of course, because we are in this lecture we are going to stress out on other things. Basically, wound healing have a very long history, and uh, the Egyptians were the first one, who were successful in what you can say, sorting out what is the infected and what is the non-infected wound. And then, of course, like, if you will see what you can say, if you will read the history, we would know that there are many inventions which were done and many discoveries which were done. For example, uh, like in like thousands of years ago, you can say that whenever there was any wound, like, they used to apply honey over that area. Why? Because honey was having some antibacterial properties, and they used to put grease as well, which act as a barrier, so that that should not get infected. But of course, like, with time, more sophisticated things, more sophisticated antiseptic agents and more sophisticated antibiotics were uh, discovered, and with time nowadays, of course, we have a range of antiseptics, range of antibiotics, range of dressings. Polymeric dressings are available nowadays. Occlusive versus semi-occlusive dressings are available nowadays. So a lot of things are available right these days. So talking about the phases of wound healing, as I told you, the first thing is establishment of hemostasis, in which there is smooth muscle contraction, there is stopping of the blood, hemorrhage by coagulation cascade, and the end product which is formed as fibrin. Okay, so simply uh, the whole idea about this thing is like after wound of course, like uh, the bleeding should be stopped. Okay, so inflammatory phase, which starts from the first day and goes up to 4 days. As I told you, there are many exudates which are formed, and that marks like the inflammatory phase is going on, and you can see that the fluid basically ooze out from that side. Why the fluid is oozing out from that side? Because of increased vascular permeability and the migration of different cells by chemostaxis, and many cytokines are released, many growth factors are released into the wound, which attract different cells. Okay, and a lot of things, they play a role in that one. If you can see over here, uh, I'm not reading it one by one, but because these things are in front of you, so you can pause this video and just read it. But what I'm saying is like the things which are related to that. So what happens? There are different growth factors, as I told you, uh, which play a lot of role in all this thing. For example, there is insulin-like growth factor, there is transforming growth factor beta, there is platelet-derived growth factor, and many, many, many more. So, what is the main idea behind all this game? Is simply because uh, all this process is basically increases the vascular permeability, attract different type of cells, macrophages and neutrophils and platelets and all these cells. Many of the cells are attracted over that side, and when these cells are attracted over that side, basically all of these cells play some role in wound healing. Okay, so what happens is once all this cells are there, like macrophages, like macrophages, like neutrophils. Okay, of course, like they each one of them, they have their own roles. Okay, like uh, like it's been a long time I have done pathology, but a few of the things which I still remember is like um, there is what you can say, they do phagocytosis. uh, so of course, like they can eat up many microbes. They release oxygen radicals, they synthesize non-nitric oxide, and many, many, many other factors, things they can do in what you can say, in increasing or in which help up this in this inflammatory phase. So see, phagocytized bacteria and foreign material and all this stuff. Okay. Now this is the stage, guys. Like whenever anyone have any wound, so what happens is, of course, um, foreign bodies should be removed. Okay. And if you know, like anyone who get any injury when they reach to the hospital, what they do, like they wash the wound by the help of some sterilized uh, normal saline, for example, right? So what we want to do, because we don't want any foreign material or bacteria in that wound, because that can delay the wound healing. Okay, so that's one of the idea. By the way, in this slide, of course, I'm not going to say all these things, but you can see over here, I put these slides over here, like what are the different cytokines, what are their sources, what is their function, and we can found them in acute versus chronic wound. Okay, their levels increase. So see, interleukin 1, 2, 6, 8, and tumor necrosis factor. So all these things, you can see a list. And if we will go, okay, let's for example, the function of IL-2, like, which is uh, given by T lymphocytes, they increase fibroblast infiltration and metabolism. If you can see over here, tumor necrosis factor alpha, like the sources from polymorphonuclear cells and macrophages, and the function is inflammation, reepithelialization, and polymorphonuclear margination and cytotoxicity with or without collagen synthesis provides metabolic substrate. So of course, like this is, you can say, a kind of revision of what you have already done back in your pathology classes. So you can see over here, and there is a long list: platelets derived growth factor, and many more, right? And what are their functions? It's all written over here. Okay, so you can see over here all these things, the list, the growth factors which are involved in them, what are their functions, how they help, and of course, like all of them, they are brought up by some of the cells which are circulating in the blood or present in the body, right? And this one is, of course, the you can say the master chart of showing different stages and different, like what you can say like the inflammatory stage, stop bleeding, chemotaxis, and proliferative stage, and all the things. So you can see like they are all given over here. So after that, of course, like there is proliferative phase, and it's the second phase of wound healing, and it roughly spans from 4 days to 12 days. And it is during this phase like the tissue connectivity or continuity is brought back. And what happens is there are different cells which are brought up to the area of wound. For example, fibroblasts and endothelial cells. You can see over here endothelial cells, and they release platelet-derived growth factor and fibroblast here, fibroblast here. So see, all these growth factors, they are released by fibroblast, 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 right? So see, just to tell you, like, see, the fibroblasts are doing, here you will see, here is fibroblast, right? So you can say that, these cells are late to migrate. Of course, like they are not the major players in inflammatory phase, but they become a very major player in proliferative phase. Okay. So fibroblasts and endothelial cells are brought up to the area. They release different cytokines, and they proliferate, they are activated, and their main function is to form the matrix for remodeling. And of course, all those growth factors, they play a role in that. So they synthesize collagen, and they are very rich in cytokines, and they are the one which like this is the stage when we see the granulation tissue. Okay, and endothelial cells also, they have a very major role in this one. The main function of endothelial cells here is basically angiogenesis. Angiogenesis means what? As the name shows, angiogenesis means the formation of new capillaries, and it is very important step for wound healing. Why? Because uh, angiogenesis will form new vessels, and from those new vessels, of course, the blood will be supplied to that area. Okay, so angiogenesis is a very important stage in proliferation. It's a very important process, sorry, in proliferation. And endothelial cells are the one which basically degrade the basement membrane of post capillary venules, and then they migrate the cells through this membrane and form new vessels. And again, like there are different type of what you can say things which are there. There are different surface adhesion molecules are there, and all these things. So of course, you can see any basic book of pathology, and or you can say physiology, and you would know like what is the process, what is the function of all these things. Okay. Okay. So simply, uh, two main cells of this stage is of or proliferation is of course um, fibroblast, and the second one are endothelial cells. Okay, and matrix. What is matrix synthesis? Of course, if you know what is collagen, collagen is the most abundant protein in the body, and it plays a critical role in successful wound healing. And it is the matrix or the collagen which when it get deposited over there, it get mature over there, and it get remodeled over there, and that's how you can say the functional integrity of the wound is brought back. There are different type of collagens which are described, like around 18 types. Okay, but the one which are very important for wound repair are type 1 and type 3. Okay, like type 1 collagen is the major component of extracellular matrix in skin, whereas type 3 is normally present in skin, but it becomes very prominent during repair process. So that is like about how the remodeling is done. And after that, then there is maturation phase or remodeling phase, and of course, uh, this is the stage when there is contracture formation, when there is scar formation. Okay, or you can say when like there is extra, you can say strength is added to the wound. Okay, now you can see over here like there could be contraction, there could be scarring, and there will be remodeling of the scar. So now what happens basically, the matrix which was deposited in proliferative stage, it get reorganized. Okay, or simply that collagen which was deposited will be reorganized. So what happens is like the collagen first is broken down by metalloproteinases, uh, and then there is a very there are two processes which occur, like collagenylysis and collagen synthesis. But like of course there is more collagen synthesis than lysis, and because of the result of that, there is reformation of the extracellular matrix. Okay, so of course, like this collagen is the one which gives strength to the wound. Okay, and if the strength will not be added, of course, a minor stress on that area can result in again opening up of the wound, right? So again, there are different things which play a role in this one, in this stage. Okay, again, fibroblasts have a very much role in this one. Myofibroblasts are there, and different type of fibroblasts are there, which basically uh, make the scar formation. So, and once the scar formation is done, what happened like in that scar, the fibroblast started decreasing, and the capillaries which were formed during the second stage are basically started regressing, and it takes around 1 week to 6 weeks, and sometimes up to 1 year, like when the strength to the wound is added. Okay, so and that is all done by collagen cross linkings and the wound contraction, which basically give more strength to the scar tissue. Okay, okay, so that what happens in these stages. And if you will see over here, uh, okay, now this one you can see over here what is immediate wound healing and what is delayed wound healing. You can see like immediate wound healing, mesenchymal cell migration proliferation, angiogenesis and epithelialization. I talk about fibroblast migration. I talk about cytokines and all those things. Okay. So, and then there is epithelialization, all this stuff. And then there is late wound healing. Means what you can say the late stages C involves the deposition of collagen and other matrix proteins and wound contraction, right? Like all the story which I told you, like what are the function of fibroblast and collagen and fibronectin and proteoglycans and all these things, right? So now the important thing which we are going to discuss now, see, all the wounds which are formed due to trauma or surgery, uh, if they heal up by themselves or heal on time, so of course, like we call it as acute wound healing. But sometimes the wound doesn't heal up properly, and then or you can say at that stage you must think what can be the factors which can delay the wound healing, or what you can say all the things which we were talking until now was about normal healing, but what are the things which can result into delayed healing or abnormal wound healing or chronic wound healing, right? Now when we talk about chronic wound healing, uh, first of all, we must know one thing that wait, sorry, not this one. Okay, okay. There are like we classify basically wound according to what type of wound is that one. For example, either it's a clean cut, either it's a dirty wound. So what happens is like there are many factors which basically play a role in wound healing. Okay, and any of the factor which goes missing or which is abnormal basically will result into chronic or abnormal wound healing. So see, slow or arrested, inflammatory or proliferative phases of healing and have increased level of matrix metalloproteinases, which binds up or degrade various cytokines and growth factors at the wound surface. And of course, treatment of causes and management of underlying medical problem restores more normal wound healing. So two type of factors are there: intrinsic or local factors and extrinsic or systemic factors. As I was talking in the start, that whenever anyone have a wound, so what they do basically, um, they wash the wound, right? To wash any foreign body or bacteria in that area. Again, depending either the wound is tidy or untidy. For example, I told you, if it's a surgical wound, like when we do surgery, of course, they follow all the sterilization techniques, and they make a clean and nice cut. So that is an example of a tidy wound. Okay. But if someone is involved in a road traffic accident, so all his wounds will not be a clean cut, rather a crushed or contaminated, and sometimes a lot of tissue is lost. So that is an example of untidy wound, right? Okay. So whatever it's a tidy wound or an untidy wound, see the different local factors which can result in delayed wound healing. One is foreign bodies, necrotic tissue. Necrotic tissue is the dead tissue. And remember, any dead tissue can result into infection, or any dead tissue is simply a foreign body which will delay the wound healing. Repetitive trauma, hypoxia or ischemia, venous insufficiency, infection, growth factors deficit, excessive protein, matrix protein degradation, and radiation. Extrinsic or systemic factors: diabetes mellitus, steroids, and antineoplastic drugs. Remember, steroids delay the wound healing because they decrease, like suppress the inflammatory process. Smoking, collagen vascular disease, repetitive trauma, chronic disease states in the body, like kidney and liver diseases, right? Okay. Um, Remember one of the thing, for example, there are different type of chronic ulcers, there are different type of acute ulcers, there are different type of wounds. Some, for example, we were discussing, not with you guys, but like your seniors, I was teaching them venous ulcers. So they are difficult to heal, right? Bed sores are difficult to heal. Human bites, like for example, if someone have a fist fight with someone, and he punch and he basically hit his teeth, so it's a kind of human bite. Okay, they are the most contaminated bites you can have. Okay, so all these are examples which what you can say, which can result, or for example, someone have a necrotic tissue or repetitive trauma or hypoxia or diabetes, or he's using steroids, whatever is that, it can result into chronic non-healing wounds. Okay, like any wound which basically fail to heal up on time, we call it as chronic non-healing wound. Okay, normally the wounds, they get healed within 3 months of time. So anyone whose wound is not healing in that time, we call that this person have a chronic non-healing wound. Okay, again, this is the main key players I was talking about, like the inflammatory process stage, uh, proliferation, maturation, and see the neutrophils, they rise up in the start, macrophages, and then you can see fibroblasts, which stayed for quite a long time, then lymphocytes, right? So fibroblasts are the one you can see, like they stay for a long period of time. Okay. Now, okay, as I told you, all those factors, the local one or the systemic one, they can result into chronic non-healing wounds, right? Now, I will go more in a clinical way. Okay, I'm going to um talk in a more clinical way how you can manage that thing, or how to approach a person in which, like, who have a delayed wound healing. uh, I show you many of the local factors, many of the systemic factors, and you can see, like, one of the local factors is infection, for example. So infections are the most common cause of delayed wound healing. Like, if there is bacteria in that area, so of course, like, they can hamper the normal healing process. And whenever someone have, what you can say, infection in any wound, so what they do is, like, they repair that area. And one of the systemic feature which I showed you was diabetes. So of course diabetes also impairs wound healing at all stages of the process. Um, so it's very important to treat the diabetes. It's very important to treat um, infection. It's very important to treat or to clean the wound. It's very important to remove any necrotic tissue. It's very important to take care of the necrotic nutritional status of the person. So all these things are very important. Okay, so normally when anyone have wound, or you can say acute wound, what they do, what the doctors do, um, uh, especially when the wound is clean and tidy, or for example, like the wound which is formed as a result of surgery, what they do, they just clean, they just explore, they remove any dead tissue, they repair any broken structure, like if there is any tendon which is broken, any nerve, any vessel which is broken. Okay, and then they close the wound by the help of sutures, for example, right? And then they apply the dressing, then they send the patient, like, or you can say they follow the patient for quite some time, and they see, like, either the wound is healing properly or not, right? This is what happens normally. But of course, we are not discussing that thing right now. We are discussing someone who don't like, whose ulcer is non-healing. So number one, first of all, you have to diagnose that someone ulcer is not healing up. Okay, so first of all, you will diagnose that, how much time is there, which have passed, and the person wound is not healing. Okay, and then of course, like, based on that, uh, we will classify that someone have a chronic wound which is not healing up. So see, now if you remember these factors, the intrinsic or the extrinsic factors, when we take the history, or when we do the physical examination, or when we go for the laboratory assessment, we are doing quite the same thing. See, in history, we must ask about the comorbidities, we must ask about the immunosuppression, either the patient is using any chemotherapeutic drugs, either the patient is using any steroids, or either the patient have HIV, either the patient have undiagnosed diabetes mellitus, or diagnosed one, any peripheral vascular disease, any coronary artery disease, any rheumatological disorders, any radiation exposure, any smoking or alcohol. So see, uh, if you will see all these things, what in we are asking in history, basically we are checking smoking, radiations, diabetes, any type of condition, right? Then physical examination, what you will do, of course, you are going to see the size and depth of the wound, the tissues that are involved, signs of infection, and any maceration, any hyperpigmentation. You will see the capillary refill, any pallor, and you are going to perform a complete vascular assessment, often requiring Doppler ultrasound of the arterial pulsations, right? So all the local and the systemic factors we are checking, and then we go for the labs. And in labs, what we are checking is electrolytes, liver transaminases, bilirubin levels, complete blood count, and radiography to determine underlying bone pathology. Okay, here you can add many things. For example, you can do kidney functions. You can do tests to check the nutritional status, like you can check the protein levels, calcium levels, and all these things, right? And you can check the biopsy as well. Very important, because sometimes when the wound is not healing up, it could be malignancy, it could be carcinoma. So of course, like, we can check the biopsy in that case. So see, not a big science, but rather what were the intrinsic or local factors and what were the extrinsic or systemic factors. We are checking the same things in history, we are checking the same things in physical examination, we are checking the same things in laboratory assessment. And management, of course, management is not so easy, or you can say it's not so um, it's not like this. Of course, like, we manage what we found. For example, if you found that someone have diabetes, you are going to treat that. If you found someone have for example, infection, you will treat that. If you found someone have necrotic tissue, you will treat that. If you found someone have any XYZ local or systemic condition, you are going to treat that. So see, of course, like, here they we have written the normal points which we can encounter. Adequate nutrition, any chemotherapy, steroids, alcohol consumption, cigarette smoking, and blood glucose level must be modified as necessary. We must provide local wound care, eradication of infection, aggressive debridement. What is debridement? Debridement is simply removing the dead tissue. Any uh, abscess, drain that. Provide antibiotics depending which one can work, like the topical one or the systemic one. Apply the proper dressings. Sometimes we provide negative pressure dressings. Edema control, elevation and wrapping. Surgical therapy may be necessary to aid the healing. And the last resort is, of course, surgical debridement with skin grafting. Okay. So of course, like, whatever we will face, for example, someone who just have diabetes and you cannot find any other local or systemic factors, you will just control the diabetes, sugar levels, right? Someone whose nutritional status is not good, so you are going to just manage that. Again, you can see over here the factors which that inhibit wound healing. Nothing is changed. Everything is there, except here you will find the names like vitamin C or A deficiency, especially zinc or iron deficiencies, or someone who is using drugs like adriamycin or glucocorticoids. Glucocorticoids is steroids, simply, right? They are the one which basically delay the wound healing, right, in these patients. So now, the important thing in this one is um, you can see, like, there are different type of wounds, and we are talking about surgical wounds. So of course, we will not discuss others right here, uh, but you can see over here ionizing radiation. I know ionizing radiation basically causes endothelial cell injury, and they, like, radiations, they, like, when any tissue is exposed to radiations, basically what happens is, like, there is atrophy and fibrosis of that tissue. And that's the reason, when there is fibrosis, basically angiogenesis cannot occur in that area. And when angiogenesis cannot occur in that area, as you know, angiogenesis is very important for wound healing. So that is because, when someone have ionizing radiations, their wound are healed, like, delayed in healing. Same thing with aging, advanced age, of course. Uh, with aging, all our body tissues have both quality and quantity is decreased, and the healing process is not so fast like what is the healing process in young people. And that's the result, like even collagen undergoes qualitative and quantitative changes, and that's one of the reason in them tissue wound, like there is delayed wound healing. So same thing with the vitamins, you can see. Okay, vitamin C and A are written over here because they are more important than others. Okay, and zinc and iron is given in mineral deficiencies because they are very important. Zinc deficiency, though it is very rare, but in people who have too much burned area, they can have zinc deficiency. Like people who have psoriasis, for example, when you will study internal medicine or dermatology, you will study psoriasis, and in that one, what happens, like uh, they like the skin is shed too much, and that's the reason like they may have zinc deficiencies. So simply all these things, and same with the drugs, right? Like as I told you, steroids basically they suppress inflammation or inflammatory process, and they impair the fibroblast proliferation and collagen synthesis as well. So many, like if you will go in too much details, of course, like you will find a lot of details about each and every of these things. Okay. So simply, like these are all the things which can result in delayed wound healing, and you can remember the factors which are local one as well as the general one. I show you how we approach a person. We take the history, physical examination, laboratory assessment, and management. Of course, will be the management of the cause. So now there are different type of ulcers as well. Okay, which are basically which can result into the chronic wound. For example, here there is given one of the things which is given over here is basically diabetic foot ulcers, right? Now, diabetic foot ulcers are difficult to deal with. Why? Because in diabetes again, the people they have a lot of you can say other things which are going on. For example, they have neuropathies, right? They have peripheral neuropathies. So a lot of things occurs in diabetes, like which result in delayed wound healing. Simply, diabetic people, whatever wound they have, like it is not you can say healed up like the normal people. So you can see over here results from undetected and untreated trauma of the to the neuropathic foot. Neuropathic foot is simply someone in which like who have a peripheral neuropathy, and when someone have a peripheral neuropathy, of course, like they have less sensations, especially to the feet, and when they have less sensations, so there is more chances to get damaged, to get injured. Okay. So see, same thing. We take the history, we do the examination. In examination, we check the quality of the peripheral circulation, evaluation of the diabetic foot ulcers. We can take a plain X-ray of the foot to evaluate the condition of the bone. Osteomyelitis is the infection of the bone. And you can see over here, of course, like it's not important to remember the treatment of diabetic foot ulcer here in this lecture, but of course, generally you should know how we deal different type of wounds. So see, with appropriate treatment, 24% of diabetic foot wound will heal by 12 weeks, 31 by 20 week, and by the use of appropriate diabetic shoe or what you can say other orthotic devices. Okay, these figures, no need to remember them, guys, because this one is taken from some study, and different studies give different values. So see, clean wounds are treated with minimal debridement and damp gauze or hydrogel based dressings. Exudative, like the wounds which have exudate formation, may benefit from alginate hydrocolloid. Close follow-up is essential. Treat the infections. Okay. Sometimes we need broad spectrum antibiotic therapy, systemic one. Sometimes exploration is needed. We have to drain the abscesses. We have to debride the infected and necrotic tissue. Okay. And sometimes we have to, if there is osteomyelitis, we have to treat that by IV antibiotics. Okay, so see, like this is how we manage the diabetic foot ulcer. Okay, now wound dressings are is a different topic, and there are different type of wound dressings which are available nowadays, of course. For like why I'm talking about this thing, because there are hydrocolloid or alginate, these type of things are written over here, so maybe like you'll found it difficult, but in simple words, there are different type of wound dressings which are available in the market, and everyone is indicated for different conditions. Okay, no one is going to ask you anything about them at this level. Okay, because with time, when you will be in practice, of course you would learn what type of different type of things are available, what type of different dressings are available. Okay, uh, like the main purpose of the wound dressing is to provide the ideal environment for wound healing, right? So uh, when we cover any wound with dressing, basically we are uh, giving a barrier from any further damage or from external um, microbes, you can say. As I told you, like in old times, like thousands of years ago, like the Egyptians, they used to apply grease to create that barrier. So sometimes we use a pressure dressing to cause pressure in that area, which basically help in limiting edema, for example, because edema also, it can result into delayed wound healing. um, so like this way, sometimes we need more hydration over that area. Okay, so simply, um, there are absorbent dressings, um, uh, like uh, like these dressings absorb, what you can say, the exudate. Okay, and then there are non-adherent dressings, like they are basically, you can say, they have paraffin or petroleum jelly on them, so they don't adhere to that area. Then there is like occlusive and semi-occlusive dressings, uh, like these dressings are waterproof. Okay, semi-occlusive just allow the gases to go inside. There are hydrocolloid and hydrogel dressings. Okay, so uh, of course hydrocolloid, as you know, or hydrogels, uh, they form complex structures with water. Okay, so like if you can see over a alginate, so what is alginate? They are derived from the algae, so they have like long chain of polysaccharides, like glucuronic acids. So they can be applied as well. Okay, so these dressings are usually used when there is some skin loss. Okay, like in open surgical wounds, for example. And then there are many absorbable materials as well. There are medicated dressings as well. Okay, which are available. So leg ulcers, arterial insufficiency ulcers, there is venous stasis ulcers. Okay, arterial ulcers are painful, venous ulcers are painless. Arterial ulcers occur at the tip of the digits. Venous ulcers, most commonly, they occur on the medial side of the leg above the medial malleolus, right? And then there are pressure ulcers, as I told you. So pressure ulcers or decubitus ulcers, if you would know, like they occur in the people who are bedridden for a long time, and they occur on the pressure area like ischial tuberosity, like the elbows, like the occipital region, like the um, what you can say, the heels which come in contact with the blood, with the bed. And that's the reason, like they keep on changing the position of the patient, like who are bedridden, like stroke patients. Okay, so that these pressure ulcers should not form. So whenever someone have pressure ulcer, so They stage them according to 1, 2, 3, 4. Like someone who have a non-blanchable erythema of the intact and the skin is intact, stage 1. When someone have partial thickness skin loss, stage 2. When someone have full thickness skin loss, stage 3. And when someone in which the underlying structure like tendon, bone, or joint capsule is exposed, it is stage 4. Very difficult to manage ulcers, you can say these are. And the prevention is like the skincare, uh, frequent repositioning, as I told you. Nowadays, electric mattresses are available for them, air mattresses, like which keep on changing the pressure areas. Okay, so you can see like different type of things which we can do in this one. Take care of the nutrition, control the infection, dressing, antiseptic solutions, wound glazing, surgical treatment sometimes is done. Same thing with ionizing radiation, as I was telling you, like the radiation, they basically cause atrophy and fibrosis in that area. Okay. Now, radiation, for example, cancer patients, sometimes they get radiotherapy and sometimes they had burns. Very difficult to heal ulcers. Sometimes even plastic surgery is needed, or you can say like the skin grafting is needed in that place to let them heal. Okay. Now, um, see what they do basically in surgical patients, especially. There are many things which they can do, which can decrease or which can basically increases the chances of wound healing. You can see over here, antibiotic prophylaxis can be given, sterile surgical techniques. Patients should be managed before surgery, like to ask them to quit smoking, take care of their nutrition. Okay. During operations, the surgeons they like we can give the patient chlorhexidine showers, which basically decrease the surgical count, and prophylactic antibiotics can be given. And during the surgery, the patient should the surgeon should have aseptic measures like scrubbing and tight glycemic controls. Okay, the length of the surgery should be minimized, and all the things factors, of course, like it can um, like by all these factors simply the chances of someone having a delayed wound healing can be avoided. Okay. uh, how when we close the wound, surgical or traumatic wound, like we call it as healing by primary intention or secondary intention or tertiary intention. You can see over here, um, any wound like which you're closing right away by approximation, by suturing, by dressing is called as primary intention. And secondary intention occurs when the wound is left open for some days so that you're not allowed to close by epithelialization and contraction. We call it as wound healing by secondary intention. And then there is um, tertiary intention, like delayed primary closure is a useful option for managing wounds that are too heavily contaminated and we cannot close by primary intention. So what they do, like they keep on, or what you can say, open it for a few days, and they observe them, like what's going on, either the area is vascularized or not, and then they can close it by later on, right? Okay, so that's all for this lecture, but I put some of the slides in which like there are some things which are available, like nowadays skin adhesives are there to close the wound, steri strips are there. You can google them, write them, and you can see like how they look like, right? Suture needles, what are they? Okay, I talk about the dressings, like okay, now suture materials, by the way, um, there are different type of suture materials that are available nowadays. Okay, So some of them, some of them they are absorbable sutures, and some of them they are non-absorbable sutures. So different type of these things are there. And uh, as far as suture technique is concerned, guys, again a lot of videos are available. Okay, what are the different sutures which are available? And why I'm not talking about here, because when you will have a surgical experiment, they will show you suturing. So, like, of course, in that way you are going to get a better concept. Okay, and here are some slides for what kind of suture materials are there: non-absorbable, a list, nylon, cotton, silk, polyester, and these are some absorbable suture materials which are used in surgery. Okay, so a list of different type of things which I already talk about. What are hydrocolloids? I talk about them. Hydrogels, topical ointments. Okay, so basically I was talking about all these things, right? Alginates and adhesive films, which there are collagen containing products, there are hydrofibers, there are growth factors which are available, there are skin substitutes. Quite interesting. Like nowadays, they have synthetic skin substitutes as well. Okay, there are many uh, allogenic products and bioengineered tissue products which are available nowadays as well. Okay, and what is negative pressure wound therapy? Sometimes we give them hyperbaric oxygen and all these things. So um, that's all about this thing. Okay, and as I told you, for example, the bites, especially human bites, are the most contaminated bites. Why? Because our oral flora have gram positive, gram negative, as well as anaerobes. Okay, so remember, like anyone who have human bite, they have all staphylococcus, streptococcus, and anaerobic bacteria. Okay, so a broad spectrum antibiotic coverage should be needed in these cases. And of course, the bites can be done by mammalian animals as well. For example, dog bites, cat bites, and you would know like different type of bacteria are present in dog saliva as well as cat saliva. Snake bites, of course. Uh, there are two types of snakes, venomous and non-venomous. So um, the bites can occur in many places. So simply, of course, dog bites, So like this is something extra you can say, but all the wound care is almost same. And anyone like who comes with bite or any type of wound, again in surgical in emergency room, what you have to do, how you can take care of the wound, take the history, do physical examination, provide them with pain medicine or provide them with anesthesia, clean the wound, okay, wash the wound and irrigate the wound by normal saline or ringer-electric solution, explore the wound. If they are bleeding, give direct pressure to stop the bleeding, elevate that area, and then if the bleeding is not stopping, you can use electrocautery or hemostat clamping can be done of the bleeding side. Debride, remove any foreign tissue, remove any dead tissue, and don't of course, like all the healthy tissue or the viable tissue is of course red, is bleeding, and then of course close the wound. So this thing, provide them with tetanus prophylaxis and antibiotic cover, right? So this is how we take care of the wound in emergency. So that's all about delayed wound healing. I hope you understand, and I will see you around in the next lecture. Thank you.